Patellar fracture with a sleeve avulsion by Julio Camacho. Definition: patellar sleeve fractures represent chondral or osteochondral avulsion injury at the inferior pole of the patella.
In today's video, we want to briefly go over patellar fractures. These are fractures of the patella or the kneecap, and they can run the gamut from severe to mild. Patellar fractures account for about 1% of all fractures. They happen mostly to individuals between 20 and 50 years of age, and men are twice as likely to have a patellar fracture as women. It usually is due to a severe blow to the kneecap, automobile accident, falling, things of this nature, although severe muscle spasms can also lead to these types of fractures. So we want to go over briefly just some of the ways that it can happen. There can be a vertical form of the fracture, as we have here, a transverse form of the fracture, as we have here, or a comminuted form of the fracture, which means it's broken into 3 or more pieces. So you've got a vertical up and down, transverse going across, and comminuted, meaning it's 3 or more pieces. Once you know what type of fracture it is, then you need to see how severe it is. A stable patellar fracture is one where it has not separated and the pieces are still touching each other and lined up. A displaced patellar fracture is one where the pieces are separated from each other and no longer lined up. With a stable patellar fracture, you usually just immobilize the joint through a cast or a splint, some sort of immobilizing knee joint that keeps any sort of flexion from happening at all. So the joint is completely immobilized and no weight can be placed on that knee or that joint for 6 to 8 weeks, basically, allowing the fracture to heal, and then that's usually followed by rehab to re-strengthen the muscles and also to regain range of motion in the joint. So stable ones are the easiest to treat. These are the ones where the fracture is not displaced. They remain together, and therefore it can be immobilized, no weight bearing, and rehab. Now displaced ones, where there's separation in the bone and the sides do not meet, this usually requires some form of surgery. And of course, if you've got a comminuted with 3 or more pieces, it absolutely requires surgery to get that to heal properly. When they do the surgery, if they're able to do it, they don't have to remove any of the bone, as in might be possible in a comminuted fracture. They usually create something like this. They use pins and tacks to take a tension line and run it in like a figure 8 over the kneecap, pinning it to the bones in the area, just to hold everything together and still. And then that is immobilized while it all heals. But you've got to keep tension on the area, because basically if you don't tie everything together, then when the quadricep flex, you pull the pieces apart again. So you pin it, put tension on it in this figure 8, which holds it all together while it heals. So the displaced form, where it comes apart, comminuted, you usually need surgery. Once again, immobilized, no weight bearing, and then a rehab follows. So it can be a very painful fracture to have. It's not that common, only 1% of fractures, and as we said, men twice as likely as women for whatever reason. But it's a very painful fracture, and one that can inconvenience you a great deal, given the fact that you're not able to use your knee and put any weight on your leg for 6 to 8 weeks, even if it's a stable one and not displaced. So a lot to take in there. This has just been a basic overview then of patellar fractures, what they are, treatment, things like this.
Clinical case: a 9-year-old girl presented with knee pain and inability to extend her leg after landing on her flexed right knee while jumping on a trampoline. Physical examination revealed superior displacement of the patella, and a radiograph showed a fracture of the patella at the inferior pole. Fractures of the patellar sleeve occur when a sleeve of periosteum is pulled off the patella. These fractures occur almost exclusively in children, before the patella fully ossifies, and usually occur in response to the pressure of a forced load on a flexed knee. The majority involve the inferior patellar pole. The fracture may be difficult to see on a radiograph, especially when the fragment of a bull's bone is small or absent. Diagnosis. In this patient, the diagnosis was confirmed on the day of injury during open reduction and internal fixation.
These are plain x-rays of the knee in a patient with trauma and knee pain. And on the lateral view of the knee, it looks pretty normal. We don't see any evidence of a joint effusion, or we don't see any evidence of a fracture. But on the sunrise view of the patella, you can nicely see that there's a comminuted fracture of the patella. So the sunrise views is often used if you're thinking there's injury to the patella, because it's really a focused view of the patella. On the lateral view, you're not able to see that fracture.
My name is Alex, and I'm making this video to talk about fractured patellas. There's not much information on YouTube about this, so I thought I'd make this video to spread the word about what to expect and maybe give you some tips too. So 4 months ago, I fractured my left patella. It was a transverse fracture that was displaced, so I need to have surgery to screw and wire it back together. And I tripped on my driveway. I don't have a good story, sorry. Hopefully yours is better. And it was a pretty devastating injury, and I want to tell you about my road to recovery, and I want to give you some tips. So, first of all, I had the surgery, had a real good surgeon here in Reno, and he screwed me back together just fine. The surgery, I had a femoral nerve block, which worked really well until it wore off 24 hours later, and when it did, the pain hit me like a ton of bricks. So one tip I want to give is be sure you take your narcotic pain meds ahead of time before the nerve block wears off, because if you don't and you let the pain get ahead of the pain meds like I did, it was pretty bad, and I couldn't sleep, and I had to take kind of a 1.5 times dose of my oxycodone to kind of get ahead of it, just so I could sleep. With narcotic pain meds comes constipation. So what I used is this Miralax, and my wife would make me a green smoothie every day and put this Miralax in it, and that worked fine. I didn't have any problems when she did that.
Conclusion. Patellar fractures in children are rare, but when present, affect patients younger than 16 years old. This happens because patella is more flexible during childhood and is less subjected to impact and tension forces during quadriceps contraction, being also involved by a large cartilage layer. Those fractures can be caused by direct trauma, excessive contraction of the extensor mechanism, or by both. The major difficulty regarding patellar fractures in children is the diagnosis. Congenital abnormalities may be confused with fractures, and the size of the fragments, particularly in slip-type fractures, may be underestimated in children due to the partially cartilaginous nature of the patella. Thank you.